Hi everyone, my name is Corey Stackhouse, a certified financial planner with Stack Enterprises. In today's video, we are going to discuss three things. First thing we're going to discuss is how you can leverage IRAs and HSAs to affect your health insurance premiums from the age of retirement to age 65. So this is going to be applicable for soon-to-be retirees or just recently retired individuals. The next concept we're going to discuss is going to be actually looking at a real-world case example of a current client of mine and how we're utilizing these strategies to help offset some of their health insurance expenses for their early retirement. And then lastly, I've got a bonus tip for anybody who is a pre-retiree who's wanting to set themselves up for success in the future. At the end, I'll share a concept how you can reverse engineer this for you. But before we begin, please contact your trusted financial professional, insurance agent, tax preparer, CPA, estate attorney, whomever you may be that you discuss these concepts with. In the event you are looking for somebody at Stack Enterprises, we are happy to help. But let's begin with our video. So first things first, we need to understand health insurance premiums for retirees. So once you turn 65, you're going to be on Medicare. I think most people are aware of that, but in short, if you don't purchase yourself a Part C or Medicare Advantage plan or a Medicare supplement with a prescription drug plan, there are some different costs for those types of things, but Medicare by itself, Part A, you're going to have a $1,600 benefit period deductible. It's going to be an 80-20 plan, meaning it's going to cover 80% of the cost from Medicare and 20% is going to be your responsibility when something happens to you. There's normally not going to be a premium for most individuals on this because they've been paying into Social Security and Medicare for at least 40 quarters or 10 years collectively throughout their lifetime. Part B, that's going to be something that you would have to pay for whenever you turn 65, or if you're still working, you don't have to until you decide to retire down the road. But in short, it's a $226 deductible, same concept, 80-20 plan. Most retirees have to pay a 100 per month premium for this. This is as of 2020. And many decide to pair these plans with a Part C Medicare Advantage plan or a Medicare supplement plan with a Part D prescription drug plan. Medicare Advantage plans can stack on an additional $0 up to maybe $100 a month on the high side for a Medicare Advantage plan. A Medicare supplement plan and a prescription drug plan all in cost, you're looking anywhere from probably closer to $150 all the way up to $250 if I'm setting a wider range than what I put on this PDF here. So retirement options for those individuals who are not 65 but need to fill that gap right there. Most individuals are going to be offered COBRA insurance from their previous employer if you're not self-employed. You're going to have that for up to 18 months. In most cases, your insurance premiums will double if you decide to keep the plan. So actually it's 102% because there's an administrative fee of 2% that all plans allow for an extra cost, I guess you could say. That is one option. I've heard anywhere from $1,000 a month to $2,000 a month, depending on the size, whether it's husband and wife or spouses, or depending on the plan that they have at their employer currently. So that is always an option for at least the first 18 months. Thereafter, you probably will have to revert to one of these two options. It will be a short-term medical plan, which these are year to year. So here is an example. I've got this client in the case study that we'll look at below. We were considering looking at a $5,000 deductible plan with an 80-20 split on it. It was going to cost him, he is a single male in his case, $760 a month. If you had a spouse, it would double, actually, approximately. And it's not going to provide it's not going to provide much prescription drug coverage help, per se. ACA, this is actually the concept that's going to be very applicable for the strategy I'm about to go through with you, but it is going to be subsidized based off of your modified adjusted gross income. That is how your IRAs and HSAs are going to help you below. Let's begin looking at 2023 contribution limits for each of the account types. We're assuming a husband and wife in the case below that we'll get to. But for IRA contributions, if you are 50 or older in the year of 2023, you can contribute $6,500 a year plus $1,000 catch up for a total of $7,500 per person, assuming your income levels do not phase you out of those abilities, which that's another rabbit hole to go down another day. For HSAs, this would be something you need to look at your current employer health insurance plans out there, but if you have the opportunity to invest in an HSA inside of your health insurance plan, it is a very powerful tool, which I've got some other videos on explaining the advantages of those. They're a powerhouse, but you can put away up to, if you're over the age of 55, $8,750 per family per year. So how's that going to affect you? Your modified adjusted gross income, in short, is going to be lowered by the dollars that you decide to put into your IRAs or HSAs. So here's a case study for Jane and John Smith. These are not my real clients' names, but just needed to replace them with somebody out there. Let's assume that their retirement income goal for their retirement plans is they want to start off first year with $80,000 of an income they need to live the lifestyle they want, in addition to maybe doing a little bit of travel and have money for their health insurance expenses and the last little bit of their car payments and whatever else they may have. This is what they wanted to start off with. In the event that they are successful in having that money socked away and have that as their income need, their monthly premium for a subsidized health insurance plan based off of that annual household income is going to be $543 per month, assuming that they pulled all that money out of IRAs to supplement their retirement income needs. In the event that they decide to add monies to their IRAs to offset their income in this current calendar year, they could do that all the way until April 15th of 2024, assuming that's tax deadline. Forgive me if it's off by a day or two because of the weekends. As long as they each contribute $7,500 into their IRAs, along with max out their HSA contributions for their last year's taxes, that would be a total deduction of $23 off of their income, which is actually going to reduce that same health insurance plan's premium down to $287 a month. If you multiply the savings that you would have from doing this, it's going to save you $30 that first year of retirement for health insurance premiums alone. And that could be a lot. That's $259 a month is what I think the math is on it. So that's how powerful this tool can be. Is again, you can leverage IRAs. You can do this even all the way into 2024 is what I want to really focus on. So talk with your tax professional or whomever it may be to see if this would be something you can utilize or do for yourself. So that was the second piece. Sorry to jump around a little bit. The third piece, that bonus tip that I told you that I would provide you at the end of this video. If you are a pre-retiree and you're wanting to consider some of these options for yourself, let's assume you have the same retirement goal. If you want to have an $80,000 retirement budget, you can start saving into Roths now to set yourself up for tax-free income in the future. Meaning, let's assume this same couple had $30,000 per year coming from their Roth IRA and the other $50,000 was coming from IRAs. That same exact health insurance plan above, that health insurance premium would only be $203 a month, assuming they didn't actually put more money into IRAs or do the HSA deductions to lower that income or the modified adjusted gross income further. So that was a mouthful, but in short, if you have the means to access tax-free money during retirement, especially during those early years, it could save you a chunk of change, anywhere from a couple $100 a year to thousands of dollars per year on your health insurance premiums until you get to 65. And again, Medicare, that's a different world. In short, you're looking at $300 to $400 per month per person inside of those plans, but it's going to be very, very comprehensive coverage. So with that being said, I know health insurance and retirement income planning and investment management, it can be a whirlwind and there could be a lot of things going on. You can use HSAs, IRAs, Roths, even your 401k plan and other useful tools inside of building the perfect world for yourself. With that being said, again, I hope that this video has provided you at least some sort of value or at least provided you some initiative to maybe contact your trusted professional to talk about this further. But in short, I appreciate your time today. I would love it if you would be willing to share this video with anybody who may benefit from this information. Also, if you guys are wanting to subscribe to this channel, I would be grateful. Once a week, at least, I post concepts in the realm of financial planning, investment management, health insurance, Medicare, life insurance, annuities, estate planning, tax planning, and more. I have a lot of case studies that I like to share with the world just to see if maybe that's useful for them. If you would like to contact our office for a complimentary consultation, you can please call us or text us at 660, or you can go to our website, www.om, if you would like to check out some more of our information, check out some more of our videos, whatever it may be, or I've got my calendar link on there too. Lastly, an ask of mine, last one would be if you would be willing to like this video. It actually helps the YouTube algorithm promote this video to new individuals because it shows that I'm providing value to you. So I hope you all have a great day. Again, this is Corey Stackhouse, Certified Financial Planner with Stack Enterprises, and I look forward to talking with you next time.